We're excited today to be here for Welcome to Our Community at Memorial Health, and I'm here with Emily Burnside, the Injury Prevention and Disaster Management Coordinator of Trauma Services. Big title there, a very important job.
I have a really fun role. I say my job is the fun part of trauma. I get to help prevent traumas and prevent injuries from happening in the community.
Summertime is here. We also know that a lot of times kids, especially in our more rural areas, are on those ATVs.
Yes.
And we love that they're having fun, but they can be very dangerous.
They can. It is a fun pastime, and it's a very common pastime here in our area. But we want to make sure that everybody is riding and driving safely.
So with the ATVs, there are a lot of instructions that come along with them. And I think sometimes they get into trouble when they're not following those guidelines.
Sure. And there are actually rules and laws and regulations put into place for our ATVs, especially here in the state of Georgia. You actually cannot ride on an ATV unless you are 16 years of age or older. And you want to make sure that there's only one person on that ATV if it's a type 1 ATV. You can have two people if it's a type 2, and we can talk about that as well. And you actually cannot ride on the highways on ATVs. You have to make sure that you're off of the pavement. So that's kind of the rules and regulations as it pertains to the law. But then there's also a lot to be educated on. I always remind folks, you know, these are actual machines. These are vehicles. It's not just something that to play with. So we want to make sure we're treating it as such.
You said highways, but those highways include public roads. They should not be out on there, mainly because number one, it's dangerous, but also at night we can't see them.
Absolutely. And you know, ATVs, they are equipped with lights, but they're not meant for highways at all, whether it be daytime or at nighttime. So we want to make sure that we're using, riding our ATVs off-road, but in areas that we're familiar with, because oftentimes our trauma patients come in and they've been involved in an accident that it's actually been off highway out in a rural area, but they're not familiar with that area. So there may be fences set up that they didn't know were there, or roots or trees. So you have to be familiar with that terrain because it can be a little uneasy or scary to ride in somewhere that you're not really familiar with.
Tell me about that type 1 ATV. What is that? Is that something common that we often see?
Yes. So type 1s, you're common. We call it four-wheelers where I grew up. Those are the ATVs that you see, and they're just your standard ATV that have the handlebars. They may have a little area on the back that looks deceiving, and it looks like you can just have a passenger hop on the back, but it's actually not what that big seat is intended for. That seat is intended for our drivers of those type 1 ATVs to be able to stand up, turn from side to side, and maneuver, especially if they're going over maybe some thick terrain. And then our type 2 ATVs would be our utility vehicles, or as we call it where I grew up, our side-by-sides, our buggies. And so those have a designated seat either beside or behind that driver that's for the passenger. And I'll tell you, they have seat belts. And we know that those ATVs that have seat belts, they're there for a reason. So we want to make sure we're using them appropriately.
What are some of the common injuries that you see connected to ATVs?
I would say first and foremost, we see a lot of head injuries, a lot of traumatic brain injuries, or TBIs, because oftentimes our riders are not wearing protective safety equipment, and that is including helmets. So we see a lot of head injuries, brain bleeds, unfortunately. Facial fractures if they're not wearing the helmet, that's pretty common, and then fractures in our arms and our legs, that's also common. We do sometimes see some internal bleeding, especially if we've had ATVs that roll over on top of those patients. Then oftentimes there's internal bleeding with them. You
brought this approved, DOT approved helmet.
I did, yeah.
You want to show us how to fit that properly? Or?
So you can see mine, and I wanted to show you that stamp right there. So this one is nice and certified. And so I'm going to put it on, and it's nice and snug, which is perfect. And they're all made a little bit differently, but they'll hook on the side. And then to fit it, I'm going to put my thumb on between my forehead and the helmet. And there should be little to no wiggle room there. So I can't fit my whole thumb, so that means it works perfectly. And then you can kind of shake it to make sure that it's good to go.
And so everybody who's on that ATV needs to have one of those helmets.
And you'll notice that mine is an open face helmet. So if you were to use an open face helmet like mine, I would want to add some eye protective gear.
Okay.
So you can do goggles to add to it, but of course there are helmets now that have the shield on it. So if you have that, then your eyes are protected.
We hear about an ATV wreck, and I think we all get very scared because we know how serious they could be.
Sure.
But we always have that sigh of relief when the young people or the older people survive. But I didn't realize the cost that recovery and all that the families go through for quite some time if these people are ever truly back to their normal selves.
True, very true. And it's not just our hospital, our inpatient costs, but these costs can last for years to come because oftentimes those patients that have those severe injuries, they're with us for a short period of time, but then they may need additional care, which could include rehabilitation units. Sometimes we have to send folks up to Atlanta to our Shepherd Center to if they have a spinal cord injury. That's an extensive cost. They may need long-term surgeries, physical therapy, and they do. The cost adds up. So it's not just that initial stay, but it's everlasting, and that's for many of our patients.
Thank you so much.
Yes.
I feel like everyone's going to be a whole lot safer this summer because of this conversation. We really appreciate it.